I'm Darrell Rigel, a clinical professor of dermatology at New York University, and I'm here today to speak with you about the importance of using sunscreen and protecting from skin cancer, and particularly the importance of using high SPF sunscreens for our patients. Sunscreen is clearly vital to the skin's health. I've been working in this area for over 30 years. I know the importance of this, and I want to make sure that I can present that to you so that you can talk to your patients intelligently and with science behind it to make sure they improve their skin health. To put this in perspective, skin cancer is truly an epidemic. There are more skin cancers than all other cancers combined in the United States, with probably over 3 million newly diagnosed cases this year alone. The lifetime risk of melanoma is rising dramatically. In 2017, about 1 in 50 Americans will get invasive melanoma, and should that rate of increase continue, by 2020 we expect it to be 1 in 40. When we look at the wavelengths that affect skin cancer risk, they're mostly the same when we look at skin cancer risk, we look at redness, and we look at photo damage. And that's really important because when we look at sunscreen and the areas that it protects and the wavelengths that it protects, you can see this overlap is critical to develop an overall protection strategy. We know that sunscreens can lower the risk of developing skin cancer. This was a study done in Australia that was done to look at the prevention of squamous cell carcinoma, and in fact, the people that regularly used sunscreen had a 40% lower risk of developing squamous cell carcinoma than those who used sunscreen only when they felt like it. Similarly, in a follow-on study to the same work in Australia, the rate of getting melanoma was also significantly less in sunscreen users. People that used sunscreen daily had only half the risk of getting melanoma compared to those who used sunscreen in a discretionary way when they felt like it. So here are two studies that you can use to tell your patients that the regular use of sunscreen, in fact, lowers skin cancer risk. We also can show this on a basic science level. In this particular study, there was a comparison made of 1 MED of UV exposure and then using an SPF 55 with 55 MEDs of exposure to compare the degree of cellular disruption from ultraviolet radiation. You would expect, if it was an SPF 55 that was working and you gave 55 MEDs, that you would get only 1 MED of damage and get the same amount of damage you would have with no protection and 1 MED. And in fact, that's what this study actually found. When you looked at matrix metalloproteinase markers such as MMP1 or MMP9, you looked at dermal damage and you found exactly that. The amount of damage that occurred with an SPF 55 with 55 MEDs was the same with no protection that you saw with 1 MED of exposure. This shows that the sunscreen is protecting at the basic cellular level from the damage that we would see from UV radiation. Now, other studies have looked at this and looked at the improvement of signs of photo damage, and the regular use of sunscreen over time can give some improvement. This recent study that was performed looked at daily uses of a moisturizer with a sunscreen of SPF 30, and what they found over a year of use, the skin texture and clarity and mottled and discrete pigmentation were the most improved parameters, but in fact, there was significant improvement, and 100% of the subjects showed improvement in skin clarity and texture. Despite all this information, this is data that's a bit concerning. If you look at who's using sunscreen, only 30% of women and less than 15% of men are using sunscreen on their face and exposed skin. In fact, less than 40% of American households are even purchasing sunscreen. So there's definitely a knowledge gap that we as dermatologists have to help close to get the message out of the importance of using sunscreen. Now, we talked about sunscreen. Let's talk about high SPF sunscreen and why it really matters. And I'm always somewhat dumbfounded when I hear my colleagues talk about, well, an SPF 50 blocks 98% of the rays, and an SPF 100 blocks 99% of the rays, so that 1% really isn't that much of a difference. But there's another way of looking at it that's much more scientific. Let's say that we had a shower that put out 1 gallon a minute of water, and we had a filter that either blocked 98 or 99% of the water that came through, just like the sunscreen would block the radiation. Well, if we had one that blocked 99%, which is an SPF 100, what we'd see, it would take basically 100 minutes for enough water to come through to fill the 1-gallon bucket. If we had a sunscreen or a filter that blocked 2%, like an SPF 50 would be, then in fact, we would only take us half the time to fill it, or 50 minutes. And if we used a filter that blocked the equivalent of SPF 30, it would only take 30 minutes to fill it. Filling the bucket effectively would be an MED, and effectively would be the time to sunburning. So there's a big difference with that little difference in protection level. Now, instead of water, let's think of these as UV photons that are coming through. And if the photons are coming through at that level, you can see that there's a significant difference in the protection that you get with SPF 100 versus SPF 50 in terms of the radiation hitting the skin and causing the damage. The other thing is that most consumers underapply sunscreen. SPF is tested at 2 milligrams per square centimeter. The reality is most people apply only 25 to 50% of the rated amount. That may be because of expense, that may be because of cosmetic feel. Whatever the reason are, typically people underapply sunscreen. This was a paper that was published in the JAD several years ago looking at this, and you see there's a linear relationship from the SPF concentration that's applied and the amount of sunscreen that's used. So for example, an SPF 70, if you applied 50% of the rated amount, 1 milligram per square centimeter, you would still be getting a 35 or a reasonable level of protection. Similarly, an SPF 100, if you applied 50% of the rated amount, you'd be getting an SPF 50. Even 25% of the rated amount, you'd be getting an SPF 25. So the higher SPFs are more forgiving in terms of the protection they derive in real-world applications. Now, several studies have looked at this. This was a study that compared using SPF 70 and SPF 30 in a real-life setting at the beach, so people applied it the way they normally would, not in a test lab, and the 70 was significantly better than the 30 in this setting. This is another study that looked at durability of sunscreens, and it compared SPF 70 sunscreen over 8 hours with exercise and water exposure, and it showed that the current sunscreens are probably more durable than the older sunscreens, even when you follow with a significant exercise and water exposure. So the higher SPF sunscreens may provide an additional margin of safety for people who do not reapply as recommended. This study was very interesting. It compared people who were at the beach under an umbrella without sunscreen versus those who were out in the sun without an umbrella using SPF 100. And what it showed was that the people who used the sunscreen, the SPF 100 sunscreen, were much less likely to sunburn than those who had the umbrella only. So the sunscreen here was actually even better than shade in terms of protection. Now finally, this is a study that really is very important because this was something that showed direct comparison of an SPF 100 versus SPF 50. This was done on skiers at altitude in Vail, Colorado, and it compared SPF 100 plus to SPF 50 plus, split face, double blind for 1 day of skiing. And what it showed is that the people who had the side of their face with the SPF 50, they had 10 times the chance of getting sunburn versus those who on the side of the face with SPF 100. This was randomized, double blind, and really showed a significant protective difference for having SPF 100 versus SPF 50. So I've shown you a number of things, several studies, a number of reasons why a higher SPF is important when we speak to our patients about the use of sunscreen. So we really need to recommend the high SPF sunscreens we choose for ourselves and for our family. This was a paper that we published recently in JAMA Dermatology, which was very interesting because it showed that 97% of dermatologists are comfortable with recommending sunscreens of SPF 50 or higher, but only 35% recommended SPF 50 plus, although 62% of the dermatologists for themselves chose to use SPF 50 plus. So there was a knowledge gap there, and the fact is we have to tell our patients to do what we're doing beyond what we're actually telling them. What was also important is that 99% of our colleagues believe that patients underapply sunscreen, which is a fact, another argument for using the higher SPF and recommending the higher SPF sunscreens. The other thing that came out of a recent prior study that was kind of interesting too was looking at what level of SPF was being recommended versus how many years in practice people were. And you can see the more years you're in practice, the more likely you were to recommend a higher SPF. Frankly, that's just because of experience, I think. You've seen patients who had problems with the lower SPF over the years, and you realize the importance of recommending the higher SPF for your patients to get the best protection. We've talked about the importance of higher SPF today, and the importance of recommending this to our patients, the fact that you get the extra protection in real-world settings with the higher SPF. What we have to do is recommend sunscreen to all patients, not just those perceived to be at higher risk. And we have to make sure we talk to our patients the importance of telling them not to underapply, the importance of protection both acutely and for long-term exposure, and the protection for extended outdoor activity. I hope the information we've talked about today is helpful for you when you discuss these issues with your patients. Thank you.